I would assume that if it like touches the first layer, it's one. If it touches the second one, it's two, and so on.
Right? That's
Yeah,
what you think.
it's not like
No,
that.
they had to throw they had to
There's
throw a
more.
curveball there
Yeah.
because it's actually not. That's where all the confusion starts.
Hi, everyone. My name is Mariam Treystman from the Home Health Consultant. And today we're going to be talking about wound staging with Dr. Robert Goldberg. We are so excited to have you on.
Thank you.
Dr. Robert Goldberg is a thoracic surgeon and wound care specialist in LA. He is a highly trained cardiothoracic surgeon who has transitioned his expertise into advanced wound care. He now operates as a mobile wound care physician and surgeon through his company, Goldberg MD Professional Medical Corporation, providing patients throughout LA with the convenience of receiving expert wound care in the comfort of their own homes. Thank you so much for being with us.
My pleasure.
Can you tell us a little about yourself, your background, and how you got into all of this?
Sure. Going all the way back, I'm actually originally from Russia. I was born and raised in Moscow. And I did 5 years of medical school there, but then I had an opportunity to emigrate to the U.S. So I did that in 2008. They didn't accept anything here, so I had to restart my education from scratch. So 4 years of college, 4 years of medical school. And then I was trained at USC for cardiothoracic surgery, but eventually realized that wasn't the field I was interested in.
It's not your vibe.
Not my vibe, no. So I transferred over to home care because I wanted to focus on patients who are homebound. They can't come out. They can't help themselves, and nobody can help them. There's very limited care that they can get at homes. So at first I did health evaluations, and eventually I transitioned, doing my surgical background, I transitioned to wound care. So I've been doing that since 2022. And yeah, we've been growing pretty well.
So what are some benefits of home health that you feel like, why do you like it? What is it about home health that you like more than, let's say, surgery? Or...
Yeah, I think, like I said, these patients are at least homebound, sometimes bedbound. And with wound care, they're unable, in order to get proper wound care, that we'll talk about a little later, you have to be able to have a qualified, at least, surgeon who can clean up that wound, get rid of all the dead tissue. And there's no way they can get that at home, usually. They can go to if they get admitted to the hospital, they get it done there. But for the most part, these patients are in low-income families, and they can't afford either insurance or either transportation or anywhere to get to a medical professional who is qualified enough to handle that.
Yeah.
And that's I noticed those patients when I was in home health evaluations as a traveling physician, and that struck me as something that, given my surgical background, I could actually help them with.
I mean, honestly, home health is just as a program is such a blessing. We're so happy to have people like you who care about the patients. And of course, they are the most vulnerable of our population. So
yeah,
let's jump into our topic, I guess. Let's talk about wound staging. So actually, Dr. Goldberg was specific about talking about wound staging. Is this a topic that you feel is necessary for home health agencies? And like, do you see problems with wound staging often?
Yeah, the thing, it's, first of all, it's the most common wound type that we deal with,
right,
along with some venous stasis wounds, but especially for the bedbound patients who are always in bed, and there's no one to turn them or to offload those the bony prominences that push on the skin, and they compress. So when the patient's laying on the bed on just a regular mattress, they compress the skin, and it squeezes out all the blood flow from it. So essentially, there's no blood supply to that area of the skin for hours and hours. So eventually, it dies, and that's how they get pressure wounds.
That sounds painful.
It's very painful, yeah.
And
very
I guess
painful and debilitating, yeah.
And the problem is probably in some level they're very hard to heal, especially if you don't know what you're doing.
Exactly, because in order for the wound to heal, there needs to be a good blood supply surrounding the wound. but because there's all that pressure on the skin surrounding the wound also, that tissue is also essentially dead or very, very chronically changed. And that's why these wounds stay there for years and years, often go to the bone, and there's very little healing that's involved, and risk of infection is enormous. So oftentimes they get admitted to the hospital, and they rack up these enormous bills for surgeries and stays. Then they get admitted to rehabs, and it's a never ending
medicalization of someone.
Yeah.
Well, we know that CMS classifies the wound care based on layers of skin. Can you help us understand?
Yeah, so there's this agency, it's called NPI-AP, which is National Pressure Injury Advisory Panel.
Okay.
And they're the ones who broke down the soft tissue layers into these crude, or the soft tissues into these crude 4 layers. First skin, then subcutaneous tissue, which is fat, followed by muscle, and then bone. A very crude anatomical classification, but and then the skin itself is also broken down into 2 layers. There's epidermis, which is an epithelial layer, and then there's dermis, which has all the blood vessels, hair follicles, nerve endings, all the good stuff. And that's followed by, again, subcutaneous tissue, which is fat, and then muscle, and then bone.
So those are the 4 layers: skin, fat, muscle, bone.
You got it, yeah.
You have to tell me like I'm in 2nd grade, because I am with this stuff.
That's okay.
I can recite like a legal text all day long from like these things, but once you hit the clinicals, I'm out.
No worries. Yeah.
So how do the different layers of skin affect how wounds are staged?
So this agency and NPI-AP, they came out with a staging, and that's where the confusion starts. So you'd think there's 4 main stages of pressure wounds: 1, 2, 3, 4.
Okay, so before you get into it, if I knew nothing and I don't know anything, I would assume that if it like touches the first layer, it's 1. If it touches the second one, it's 2, and so on.
Right? That's what you think.
It's not like
no.
that.
They had to throw a
There's
throw
more.
a curveball there.
Yeah.
Because it's actually not. That's where all the confusion starts. But the first 2 stages are actually all involving the skin. Okay. And that's basically because of the interventions that you have to do in order to avoid further progression, and also varies the treatment. So the first stage is called non-blanching erythema, and that's basically that in normal language is that basically means that the skin is red, and if you press on it, usually it goes white, because if it's just dilated blood vessels that cause some redness, then you squeeze out the blood, and it turns wet.
Oh.
But in this case, because there's damage to the skin, it doesn't turn white. That's why non-blanching part is it doesn't turn white.
Gotcha.
So non-blanching erythema, the redness that doesn't turn white, there's damage to the first layer of the skin, epidermis, and some damage in dermis. But the first stage is basically limited to the epidermis, so the first layer. The second stage is where we get into the dermis, the second layer of the skin. That's where all the blood vessels are, like I said, the nerve endings, and that's the first time that we actually see opening of the skin. It could also
so the first stage could be like a fully intact closed
skin.
It's just there's like problems underneath or whatever.
Correct. Yeah.
Gotcha.
And just the color change.
Okay.
And that you can't affect with compression. The second stage is when you finally see open skin. It could present as a blister, fluid-filled blister.
Interesting.
But that's basically the first layer, epidermis, separating from the dermis, because there's accumulation of fluid between them, so it pushes out and becomes a blister.
Gotcha.
So that's the second stage. That's either blister or epidermis comes off, and there's a moisture, there's drainage, so you see the dermis. But at that point, it's still not full thickness. So that's still stage 2. Then we have stage 3, and stage 3 is when you have involvement of the subcutaneous fat. As you can imagine, the fat layer, depending on the person, could be quite substantial. So, or there's no fat layer because someone is very undernourished. So basically, that can extend for quite a while. But that's stage 3, and as soon as we get past the fat layer to the muscle, and there's also connective tissue sac that surrounds the muscle, kind of holds it together. That's called fascia. So as soon as you get to fascia, that's stage 4. Gotcha. You get past fascia, stage 4. You get into the muscle, stage 4. You get past muscle, into the bone, stage 4. Always stage 4.
Past the fat, stage 4.
Past the fat, stage 4. That's right.
Past the fat, stage 4, guys.
That's right. That's where the confusion starts.
Gotcha. I'm already confused. But it starts at 4. At 3.
It starts what?
The confusion.
The confusion starts at 3.
Okay,
You're correct. Yeah.
So actually, I watched a couple of prep videos before this, and that is consistent to the videos I've watched, where they said if it's not 4 and it's not 2, then it's 3. That's
very accurate.
Yeah. Okay, good. Great. So what are some common pitfalls of wound staging, and how can people avoid them?
So the main pitfall is that there's 4 layers of skin, and then there's 4 stages.
Yeah.
And then people confuse. They're like, oh, so there's skin, fat, muscle, bone. 4. That means the first stage is skin, like you said in the beginning. First stage is skin, second stage is fat, third stage is muscle, fourth stage is bone. I had a professor, very established here in Beverly Hills, professor of podiatry, who deal with pressure wounds all the time, on the heels, on the feet. He tried to convince me. We're not gonna say names or anything, but he tried to convince me that stage 3 was muscle and stage 4 was bone. And we spent like 30 minutes on the phone. Like I'm trying to tell him, like, you're wrong. Just look it up. He's like,
he was confused too.
Yeah, he's like, I'll send you the scientific article where you'll see that these are the layers. Okay, great. He sent me later the article that said obviously there's the muscle stage 4. And I just sent him said like, good job. But
you're like,
but that's the extent of confusion that's going around. And first, the fact that it's 4 and 4 layers of skin for 4 stages. But the other fact is for coding, when you do a procedure for coding, they also kind of confused because there's a code for debridement. Debridement is basically cleaning up all the dead tissue off of the surface of the wound. And if you bill it, there's a CPT code to bill Medicare. You code 11042 is for fat debridement, 11043 for muscle debridement, 11044 for bone debridement. So that's also kind of another curveball. Like, oh, so the stages are like that.
Yeah.
So that's the confusion.
So the stages are one way, the coding is a different way.
Yeah,
everything
points to staging being fat second, muscle third, and bone fourth. But no, it's actually the opposite.
The thing is, if it was simple like that, then
everybody would do it.
Then everyone would do it, yeah. So it's not just us guys. It's not just home health and hospice that's like
it's a professor of podiatry too.
And whatever, yeah. So don't feel bad if you're falling into these pitfalls. But I'm really glad that you broke this down. Do you have any tips for people outside of the 4 stages and confusing and all that stuff?
Yeah, I mean, I would focus always, like, stop yourself and remind muscle is 4 and then go from there. Oh, so muscle is 4, then before that there's fat, then that's 3, and then there's also 2 layers of skin, epidermis and dermis, so that's 2 layers, then it's 2 stages.
Right.
So always go from muscle is 4, remind yourself, just remember that muscle 4, and then you'll be okay.
But you were saying essentially that the reason that it's like that is because of the interventions.
Yeah.
So it's not so much on the anatomy of like what it touches. It's just based on like the kind of things you do.
Right. Basically, because the fat is still not as deep as muscle and not as serious, and it heals much faster. But if it's muscle involvement, then the infection could get under the fascia, which was that sac.
Yeah, that holds it all together.
Yeah, right. Surrounding the muscle, and then the infection can spread really fast under the muscle, into the bone, and the complications starting with stage 4 are
terrifying.
far worse than stage 3.
Usually how it goes.
Yeah.
Okay. Yeah. Well, thank you so much for that breakdown. This was Wound Staging with Dr. Robert Goldberg. And real quick for our audience, can you tell us how can people get in touch with you? How do they find you?
Yeah, so my company name is Goldbro, which comes from my name, Goldberg Robert. So the first 5 letters of my last name, the first 2 letters of my first name.
Yeah.
That does make sense. So Goldbro MD PC, professional corporation. So my website is just goldbro.md, and that's all.
Perfect.
And then you will find the phone number, office phone number for my assistant, and email address. And then if you have a referral, you can just either call us or email with the details.
And can people outside of Los Angeles work with you, or how can they work with you?
Not yet. Eventually, I will expand to hire some mid-levels. But for now, I try to focus. That's the whole idea, for an actual MD physician to go and see the patients. That's what
the whole point.
That's what sets us apart from other groups that do this.
So this was Wound Staging with Dr. Robert Goldberg. I'm Mariam Treystman from the Home Health Consultant. And if you like our content, please like, share, and subscribe. Thank you.